All right, welcome back to the Urology Care Podcast. I'm going to let my guest introduce himself now.
Hi, everybody. I am Dr. Aaron Spitz, and I'm a urologist practicing in Southern California. I serve as voluntary faculty for the UC Irvine Department of Urology, and I serve the American Urological Association as the lead delegate to the American Medical Association's House of Delegates, where we set medical policies.
Today, the topic of our discussion is going to be penile health. Dr. Spitz is the author of a new book that we're going to talk about a little bit later. I just want to jump into it here. When it comes to penile health, what are some of the most common issues that men face?
The most common malady that men face is erectile dysfunction, an inability to get or keep an erection for satisfactory sexual relation. But there are also a slew of other conditions that I encounter and help men with, including Peyronie's disease, which is an abnormal curve or deformity in the erection. And men often get infections of the skin of their penis or in their urethra. These can be sexually transmitted diseases, or they can be things like jock itch or a yeast infection that's not sexually transmitted, but is an infection nonetheless. It can be things such as genital warts or herpes as well. And then there are the more rare but more serious issues such as penile cancer.
To the best of your knowledge, what are some of the most frequently asked questions you get about penile health? What do men want to know? What do you hear?
Probably the most common question I get asked is whether or not a person's penis is too small. Men are very inappropriately worried about the size of their penis. And this is probably akin to the way women have become inappropriately concerned about their bodies as well, due to images we see in the media. Although the penis is not an image we see in the mass media, but there is certainly a lot of lore and a lot of stigma associated with the penis that makes so many men self-conscious about how sexually adequate they are. And it's also not just size, but it's duration of lovemaking and other aspects as well. With regards to legitimate concerns, there are many men who are wondering if the medications such as Viagra and Cialis and the others that have come out are safe. There's still a great deal of concern that these medications for erectile dysfunction can cause serious heart problems, because early on in the release of these medications, there were some very highly sensationalized stories about this, but it turns out that these medications are very safe, and really the only significant risk is if they are taken simultaneously with nitroglycerin or nitroglycerin-containing medications. But aside from that, these medications don't harm the heart.
So I have your book with me, The Penis Book, A Doctor's Complete Guide to the Penis, from size to function and everything in between. And I'll also note it includes a 5-step plan for maximum penis health. And so tell me about this book. Where did the idea come from? What are you setting out? What kind of questions are you setting out to answer with this book?
The idea for this book arose from several years of appearing on television, speaking about these kinds of topics, and also an entire career of speaking about this and helping my patients with issues related to the penis. And I began to realize that a book is an excellent vehicle for educating not just my patients, but a much larger audience of patients and people in general. Mm-hmm. And so I really have arrived at a point in my career where I have the expertise and the knowledge to provide a comprehensive treatment of the subject of the penis. And so that's what this book is. It is a comprehensive treatment. It covers the normal and the abnormal. It answers questions that are just curiosities, and it helps direct patients with significant medical conditions to seek the proper care and understand the kind of care they're getting. So we start out with very useful information for anyone, such as how does a penis work? What's the anatomy of it? How does an erection work? How does ejaculation work? How does testosterone get produced? And what are the normals for these various bodily functions and systems? And then we go from there into specific conditions, specific things that can go wrong and how they're treated, such as erectile dysfunction or premature ejaculation, Peyronie's disease, or low testosterone. And then we get into issues of infections or skin conditions or cancers, and we even cover controversial topics such as circumcision, as well as cutting-edge topics such as penis transplantation and even gender reassignment surgery. So the book really covers, I won't say from soup to nuts, but from penis to nuts, all the topics that you could imagine, even with a chapter showing the cultural impact of the penis in media.
It seems like it's a book to educate people because, as I'm reading here in the introduction, there's an importance of getting the conversation started because confusion, fear, desperation, these type of things prevent men from speaking up about issues that they may have with their penile health.
Absolutely. You know, men are notoriously bad about seeing doctors for medical conditions in general, and you can compound that many times over when it comes to medical conditions about their penis. There is a great deal of stigma associated with the penis and with male sexual health, and the advent of medications like Viagra and Cialis, with their huge direct-to-consumer marketing, have done a lot to break that stigma down. But we're talking about centuries of stigma up against this very recent blip in human history of making it an open discussion. And so men are really hesitant to bring it up with their regular doctor. And even when men are referred to me by their regular doctor specifically for their condition, it's hard for them to start the conversation and let me know what they're there for. Or they'll describe some other condition that's not related to their penis, and as the encounter is ending and they're heading towards the door, they'll pause and say, "Oh, by the way," and then reveal what is wrong or what is concerning them. And so even in the context of seeing the guy who's there to help you with your penis, it's difficult. So I wrote this book with a light touch. There's humor peppered throughout it, but it is scientifically robust. But with a little bit of a lighthearted tone, I hope to break down the fear, the anxiety that can be associated with these issues. And kind of use that as a spoonful of sugar to help the medicine that's in this book go down.
What are some signs and symptoms that a man may have that they really should be speaking up to their doctor about when it comes to the penis? I mean, we talked about ED, erectile dysfunction. What about lumps and signs that something maybe is off? What's common?
Well, let me actually address ED, because what many people don't realize is that erectile function is really just a window into the overall health of the guy. The penis is primarily a bunch of tiny blood vessels that fill up with blood, and that's how it gets hard. And so if there are problems with your circulatory system, your heart, your arteries, that can be reflected or that can be indicated by the penis as an early warning sign long before you have a heart attack or a stroke. The penis is like a canary in a coal mine. The penis also requires nerves to trigger it. There's a problem in your neurological system, multiple sclerosis, a brain tumor, diabetes affecting your nerves. The penis, again, may be your early warning sign of that, as well as with your hormonal balance. Normal levels of testosterone are required to maintain healthy erections as well. And low testosterone can be very sneaky. It makes you fatigued. It makes you less mentally focused. But these are things that we'll often write off to just the normal aging process, along with erectile dysfunction. But erectile dysfunction may be your only clue that you have low testosterone. So erectile dysfunction, problems with your penis functioning sexually, actually is a really important symptom to pay attention to.
Got it.
But on to lumps and bumps, yes. If there is something that doesn't look right on your penis, don't hesitate to get seen. Fortunately, cancer is very uncommon, but when it is present, it is one of the more lethal cancers there is, so early detection is key. And sexually transmitted diseases such as genital warts, although they rarely cause cancer in men, are a very common cause of cervical cancer in women, which is a very aggressive disease. So absolutely pay attention and get checked out if you notice something's not right down there.
Yeah. And Peyronie's disease, what would maybe be some signs of that?
So Peyronie's disease is surprisingly common. It's about 10% of men notice a deformity, a bend, an indentation, a twist in their erect penis. The flaccid penis tends to look normal because this condition is impairing the ability of the penis to expand properly in a certain spot. So you get this deformity or kink or angulation. What men often notice, though, is in the beginning stages of it, there's some pain in a spot in their penis and perhaps even a lump. But that tends to go away. Now, many men are alarmed when they notice a painful lump in their penis because the first thing they think is, hey, is this cancer? But penile cancer tends to be an abnormal growth on the surface of the penis that then invades inward, whereas Peyronie's is a lump under the skin and the skin overlying is normal.
And so we were talking about how the book is kind of written in a lighthearted, serious subject matter written in a lighthearted tone.
That's right.
And I'm just going to read the dedication page here. Is that what this is?
Please, yes.
This book is for anyone who has a penis or knows someone who has a penis. So I think this book is just about for everyone, it's safe to say?
Just about for everyone. Yes.
Okay. So one more time, please just let us remind us of the name of the book and where people can go and get it.
So it's called The Penis Book, A Doctor's Complete Guide to the Penis from Size to Function and Everything in Between. It is available on Barnes & Noble, Amazon, available on Kindle. It will soon be available as an audiobook on Brilliance Audio, sure. Which I was fortunate enough to be chosen to narrate. It's also currently being translated to be published in about 6 different languages, including Italian, Dutch, Romanian, Czechoslovakian, Turkish, and I hope that it is an ever expanding list.
Well, thanks so much for coming on and discussing the book and penile health in general. I loved having you on. Thanks again.
Well, it was my pleasure. And even though it's called the Penis Book, it truly is for everyone, because not only does it serve as a user's manual to guys, but it also serves as key intel to gals as well.
This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org.